Good afternoon and welcome. I'm Mike Whitaker, and on behalf of Nationwide Marketing Group, we're glad you were able to join us today for this very informative webinar. We do have a couple of notes to share before we begin. First, we'd like to remind you that the Paycheck Protection Plan has been extended. We encourage everyone to take a few minutes to look at the latest information, all available on the SBA's website, for the updated guidelines on this important program. A great deal has changed since the program was introduced, so make sure you're up to date to ensure the maximum benefit for your business. Over the past few weeks, we've seen not only record numbers of new COVID cases in many states, we've also seen an increasing number of both states and local municipalities implement requirements on masks being worn, with a variety of regulations in place. If your area is impacted, and you find yourself needing masks or any other personal protective equipment, the nationwide exclusive O'Rourke Retail PPE program remains in place and remains a not-for-profit partnership between O'Rourke Sales Company and Nationwide. Visit the exchange on MemberNet for the latest product selection and pricing. We also know that as the pandemic continues to develop, many of you have had questions. Our hope is that many of those questions will be answered on today's webinar. But should you need assistance, guidance, or resources, our ask@nationwidegroup.org email address remains open and manned daily. Send your questions and we'll work hard to get you the answers that you need. Now, today, we're honored to welcome back Jill Stricklin, a partner at Constangy, Brooks, Smith, and Prophete. Many of you have heard from Jill on past webinars and have come to appreciate her expertise and powerful insights. We're also welcoming attorney Sarah Phaff from the Atlanta office of Constangy, Brooks, Smith, and Prophete. Sarah has been a leader on employment issues related to COVID-19, and she'll share her experience and learnings with us today as well. As we begin today's webinar, you'll notice that all attendees are on mute, which allows everyone to clearly hear our presenters. As the webinar proceeds, please feel free to use the question button here on GoToWebinar to send in any questions that you have. And I'll ask the most frequent questions to Jill and Sarah at the conclusion of their presentation. We'll also make a video recording of today's webinar, as well as the presentation itself, available to you later today. Now, without further ado, I'll turn things over to Jill Stricklin and Sarah Phaff.
Hello, everyone. This is Jill, and I'm so pleased to join you. Thank you, Mike, and thank you all for being here with us today. Sarah and I feel very honored to provide this update on COVID-19 in the workplace. And at this point, COVID-19 unfortunately needs no further introduction. As Mike indicated, positive COVID-19 cases are on the rise. Just today, we eclipsed 4 million nationwide positive cases. And these ongoing increases in cases are spiking regionally around the country. Right now, the highest number of positive cases are reported in Florida, Texas, and California. And as we've indicated in past webinars, we expect this trend to continue at least for several months or until there is a vaccine, with various parts of the country showing increases in spaces and cases. And meanwhile, we've had, of course, some of the state-by-state restrictions and local restrictions on businesses and social interactions easing up, with a number of businesses reopening. I'm sure a number of your businesses have reopened and seen, I hope, a resurgence in business. And then finally, we're all preparing for the upcoming school year. During the last academic year of 2019 to 2020, every single state in the country had schools closed at some point due to the COVID-19 pandemic. And the majority of the states, once the pandemic was underway, closed schools for the rest of the year. And although this might not directly impact your business, it certainly impacts your employees. And right now we're seeing all states working hard to make plans and considering alternatives to regular in-person learning, including remote learning options, alternating school days, delayed reopenings, and reductions in classroom sizes. And as these, for your employees that have kids, school-age children, these changes in the school schedules and school operations very well might impact your employees' availability to work. So that's where we are now. Sarah and I have worked with Mike to put together an agenda that we believe will address many of the issues that you are presently experiencing or that you may be experiencing in the upcoming months. As Mike indicated, we hope we'll answer a number of your questions today. And if you have more questions that are not answered, please forward them to Mike. Our agenda today, in a moment, I'll turn matters over to Sarah, who will talk through her experiences in addressing suspected or confirmed cases of COVID-19 in your workplace. As Mike mentioned, Sarah has really taken a lead in our law firm in terms of staying on top of developments related to the coronavirus pandemic. She's worked with a number of our clients on the practical aspects of applying this guidance. And the guidance is continuing to change all the time. Sarah and I have had to do updates to our updates as we were preparing for this program, and the most recent CDC guidance on returning to work, as Sarah will discuss in a few moments, just changed within a matter of days ago. Next, we'll talk about handling return to work issues for employees who have been absent due to suspected or confirmed cases of COVID-19. And then we'll move on to discussing some of the leave requirements for employees who miss work for reasons related to COVID-19. And that might be their own illness or suspected illness, their own quarantine for various reasons, or it might be their need to care for other people who've become sick, or as I mentioned, their inability to work or their need to be at home due to the closure of schools for school-age children. And we'll talk about those leave requirements not only under the Families First Coronavirus Response Law, which was put into place in March of this year, but also under more traditional leave laws, such as the Family and Medical Leave Act, the Americans with Disabilities Act, which requires employee leave in certain situations, and some other leave issues. And again, as always, continue to pay attention and watch this space. The coronavirus circumstances have continued to develop, and our understanding of the way this disease is communicated has continued to improve over time. And as matters develop, we continue to see ongoing changes in the guidance and the recommendations and the requirements for employers to follow. So what we're telling you today is current as of today, might not be current anymore tomorrow or in the upcoming weeks or months. So continue to watch this space, please. And with that, I'll turn it over to Sarah.
Hello, everyone, and good afternoon. It is a pleasure to be speaking with you all today, and really appreciate you all having us on to talk about what we think are some really pressing issues for employers dealing with suspected or confirmed COVID-19 cases in the workplace. As Jill mentioned, as COVID-19 cases are on the rise, employers are more and more encountering issues of employees who are either suspected or confirmed to have COVID-19 and are dealing with how to handle that in their workplace, which is a new challenge for everyone. So we're going to begin today with tackling some of those issues and looking at them from various guidance sources. But because, as we mentioned, the guidance on this topic is constantly evolving, we wanted to start with where employers should look when they're looking to evaluate what guidance is available to them so that they can have some resources to look at for their workplace. So these are just a few places to start. The Occupational Safety and Health Administration, referred to as OSHA, has a variety of FAQs and resources available to employers related to COVID-19. The Centers for Disease Control and Prevention, or the CDC, as many of you are probably already aware, has a variety of resources for businesses and workplaces, including FAQs and various guidance regarding return to work, which we're going to discuss in more detail today. The Equal Employment Opportunity Commission, or EEOC, has released some specific pandemic-related guidance related to COVID-19 to address some questions for employers that are unique given the nature of the pandemic. And we're going to discuss some of that guidance today, but there certainly is a lot more out there. The Department of Labor has also issued a variety of guidance on various topics, including a few that we're going to cover today: the Families First Coronavirus Response Act, the Family Medical Leave Act, and the Fair Labor Standards Act. Lastly, a lot of states have also issued their own guidance that may come from state governors' offices in the form of executive orders. It may also come from state and local health departments who published or implemented guidance for employers related to COVID-19. A lot of this guidance is also constantly changing, as Jill mentioned. Some of these governors are issuing new orders on a fairly frequent basis, and the guidelines in those orders may be more restrictive than the guidelines outlined by the CDC. For example, some governors' orders require temperature or test taking. Some of the orders include specific PPE requirements and a variety of other issues. So we're going to turn today first to taking a look at some guidance from OSHA. They specifically have also published what they've called a guidance on returning to work as a helpful resource for employers. That guidance is available on OSHA's website along with their FAQs. And I thought this would be a great place to start as we're thinking about what to look at in terms of when an employee tests positive for COVID-19. So here's what OSHA has to say. When a worker tests positive for COVID-19, they should be notified by their healthcare provider or the public health department, and they'll likely, and I'd say this is almost certainly, be advised to self-isolate and or seek medical care. They recommend, of course, that workers tell their supervisors if they've tested positive so that employers can take steps in accordance with CDC guidelines, which we're going to talk about in a little bit more detail, which include cleaning and disinfection to protect workers. OSHA is also referring employers to follow the CDC recommendations for community-related exposure, which we're going to talk about, and follow their recommendations related to returning to work, and of course their guidelines regarding cleaning and disinfection practices for employers as well. So this is a great place to start because we're going to dive into each of these topics. Okay, so we're going to take a look now at the CDC recommended guidelines. So the CDC also has provided what they call their Resuming Business Toolkit. This is available at the CDC's website, along with a variety of other resources for businesses and employers. Public health recommendations have, of course, had to be updated as a result of changes related to COVID-19. New information has become available, and they've also tried to simplify some of the resources that were originally available to make them a little less complicated and a little bit more digestible. Of course, they are updating these. As Jill mentioned, we've got a lot of updates to the updates. In fact, some of the guidance that we talked about are going to talk about today was updated as recently as just a couple of days ago. So they are constantly updating this guidance. So sometimes you've got to check and recheck what's available. Okay. New recommendations, of course, are based on additional evidence regarding the transmission of the virus, and they've adjusted things like the return to work guidance based on whether or not individuals are asymptomatic or symptomatic. Increased community transmission, a need to communicate effectively, and of course, additional guidance on focusing on personal prevention strategies, things that we'll discuss later on in the guidance as well. So we're going to move to our next slide here. So we're going to jump into some scenarios because we thought that would probably be the most helpful in walking through some things to do here. So first question. What should employers do if an employee comes to work with COVID-19 symptoms? Okay, this is what the CDC recommends. They said employees who have symptoms of COVID-19, and we're going to talk about what a symptom is, because that's another one of those areas where there's been an update to the update. The symptoms 3 months ago are not the list of symptoms now. When they arrive at work or become sick during the day, should immediately be separated from other employees, customers, or visitors and sent home. Employees who develop symptoms outside of work should notify their supervisor and stay home. So the bottom line is, if you've got symptoms, keep employees out of the workplace. Sick employees should follow the CDC recommended steps to help prevent the spread of COVID-19. Employees should not return to work until they've met the criteria to discontinue home isolation. And we're going to jump into that. That guidance, again, was just updated just a few days ago. And what they really mean by criteria for to discontinue home isolation is, what does it mean for an employee to be able to return to work? Employers should not require sick employees to provide a COVID-19 test result or healthcare provider's note to validate their illness or to qualify for leave. Again, that's a recommendation from the CDC. State guidelines may vary, and specific employment practices may vary. Healthcare provider offices and medical facilities may be extremely busy during this time, and employees' abilities to obtain testing also may be slowed down. So we're going to take a look at some of these in a little bit more detail. Okay, so I wanted to jump into, well, what exactly is a symptom? So a symptom may appear 2 to 14 days after exposure, according to the current CDC guidance, and people with these symptoms may have COVID-19. So here is the current list of symptoms. Again, this list has evolved and changed over time. The original list was, I think, just 3 or 4 symptoms, and we've obviously got a much longer list now. So fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. And this list, of course, as they caveat say, does not include all the possible symptoms, but it's the most current list available on the CDC's website today. So just wanted to walk through that since we know that that's changed. Okay. What should employers do if an employee comes to work with COVID-19 symptoms? So like we've talked about so far, we now know what a symptom is. We now know that if employees come to work with symptoms, they, should be mindful to stay out of work. So what do you do now that you've separated the sick employee, or, they've called you and told you that they're sick, and you've told them to stay home, right? What do you do next? Sometimes you don't need to necessarily shut down your facility, but the CDC does provide some guidance about cleaning and disinfecting. Again, that's available on the CDC's website. And there's generally some certain areas that you may need to close off that have been used by the sick person for prolonged periods. The CDC recommends that you wait 24 hours before cleaning and disinfecting to minimize the potential for other employees being exposed to the respiratory droplets. Again, the CDC has got some more specific cleaning and disinfection recommendations that are also tailored to different sorts of workplaces. And also, certain states have provided some specific guidelines for certain types of businesses to follow as well. But this is one place where you can go to get some information, for example, about the types of cleaning products that should be used. They specify certain EPA-approved products to kill viruses, and methods and mechanics and PPE that should be worn by the folks doing the cleaning. The next step, so now we know we've sent home our sick employee and we've done some cleaning. The CDC also recommends that the employer also should determine which employees may have been exposed to the virus and to take some additional precautions. And we're going to dive into that later, because what is essentially, I think the follow-up question is, well, what does it mean to be exposed? So we're going to jump into that question a little bit later as we kind of unpack a lot of these issues. So if an employee has COVID-19, the employer, it's recommended by the CDC, should inform fellow employees of their possible exposure, but maintain confidentiality as required by the Americans with Disabilities Act. So you'll probably remember earlier I mentioned the EEOC guidance. Well, this has been kind of the big area for the EEOC is what information you can provide while discussing possible exposures for employees. The EEOC has made it very clear that they prefer require that employers keep the name and identity of any employee who has tested positive or is experiencing symptoms or otherwise has medical information confidential. What that means is if Sarah tests positive for COVID-19, I can't tell Jill and Mike that Sarah has COVID-19. I might be able to tell them that they have been potentially exposed to someone who has COVID-19, but I can't express that it was me, right, Sarah, who had COVID-19. There's also requirements about keeping confidential medical information confidential. The next recommendation from the CDC is employees who test positive for COVID-19. Again, this is an important point to point out. There are a lot of types of tests floating around there. And when they're talking about testing here, they're really talking about the test to detect whether or not you have COVID-19, not the antibody tests or serological tests that I think they've referred to in some of the other guidance. So when we talk about testing here today, what we're really talking about is the test to detect the presence of the virus. Should be excluded from work and remain in home isolation if they do not need to be hospitalized. So again, sick employees shouldn't be in the workplace. Many states also require or have ordered that employees who test positive for the virus need to either self-isolate if they're not hospitalized as well. Employers may need to work with their local health department to determine which employees may have had close contact or who may need to take additional precautions. Some health departments are contacting employees for the purposes of health and contact screening. There are some sort of ADA concerns there. And so, if that happens, you can certainly seek some legal counsel depending on how that process is going. But generally, employers, may need to work with their local health department or seek guidance according to the CDC's recommendations when employees have had close contact with someone else with COVID-19. Okay, so if we move on to the next slide, I think we'll talk about what should employers do if an employee comes to work again. We're still kind of work through these symptom issues. These sick employees should follow their CDC recommended steps. We're going to talk about this in a little bit more detail, but they should not return to work until they've met the criteria for home isolation. Again, antibody tests should not be used. So when we're talking about testing, we're talking about the test to detect the virus. And when we're looking for who in fact has been exposed, the CDC recommends that you follow what they refer to as their public health recommendations for community-related exposure. And that's exactly what OSHA was referring to kind of in our earlier slide. And instruct exposed employees to stay home for 14 days, telework if possible, and self-monitor for symptoms. And so again, we're going to talk about what it means to be exposed. So here we are. So I'm going to kind of walk through this and kind of give some examples here. But essentially, how the CDC defines employees who have been exposed are those that have had close contact with someone who is infected, which is defined as being within about 6 feet for 15 minutes or more. And that's sort of the basic definition of exposure. Potential exposed employees who have symptoms should self-isolate. Again, those who do not have symptoms also have a 14-day period where they should, remain at home or in a comparable setting. So again, kind of tying back to the slide we just looked at before, the CDC essentially recommends exposed employees quarantine for 14 days. All other employees should self-monitor for symptoms, meaning those employees who have not been exposed. So again, the CDC defines exposed as being within 6 feet for 15 minutes or more. So as a practical matter in the workplace, if I'm Sarah and I had COVID-19, and Jill and I, worked together in the same workplace, and Jill and I were working at the counter together, and we were within about 3 feet of each other because we happened to be, kind of narrowly on a counter trying to do some tasks, right? And we were working on some tasks, and we were together for about 20 minutes. Well, Jill and I would have been, close enough, and Jill would be considered exposed if subsequently we found out that I, in fact, had COVID-19. So, we're going to talk about that. There's a follow-up question here, of course, which is, well, what if both Jill and Sarah were wearing a mask during that time? The CDC's guidance does say we still consider those folks exposed for the purposes of this contact tracing analysis in their most recent public health guidance. So, whether or not you were wearing a mask, there's been some varieties of that guidance, but the most recent guidance just says look at whether or not you're within 6 feet for more than 15 minutes or more. Okay, so we're going to take a look at the next slide. Now, this is where things get a little bit more complicated, right? So now we're thinking, okay, well, when was Jill in contact with Sarah, and when was Sarah, who has COVID-19 in this example, last at work, and how do we measure who in fact is exposed? So what time period are we looking at? So in their community health related exposure guidance, the CDC provides the following general guidelines. And I will caveat our 6 feet and 15 minutes example. If you have some, extenuating factors there, for example, I think the CDC gave one example where the sick employee sneezed in the face of someone else. Well, that even if it wasn't for 15 minutes, that might still be considered an exposure. So you might have to use a little bit of judgment when it comes to those assessments. But so here, as we're looking at the time frame, here's what the CDC said. So I'm going to go through these and do some kind of practical examples. So a person with COVID-19 who has symptoms in the period for 2 days before the symptom onset until they meet the criteria for discontinuing home isolation. That's when an individual has had close contact with someone with COVID-19. In the event that the person who has tested positive for COVID-19 does not have symptoms, so you can't measure the time period from when their symptoms became onset, essentially, or when their symptoms started, the 2-day period begins before the date the specimen was collected until they meet the criteria for discontinuing home isolation. And again, remember, this is irrespective of whether the person was wearing a cloth face covering or not. And in order to sort of streamline the guidance, I think that takes out one factor from the analysis. So as we're looking at this, kind of want to walk through a couple of examples. So if Sarah has COVID-19 and she came to work on Monday and didn't know she had COVID-19, and then on Tuesday calls you on the phone and says, hey, I have COVID-19. I took my test on Friday and I just got my results today. Okay, so we know Sarah was in work on Monday and she worked on Friday. Friday was the day she got tested, and she just told me about it on Tuesday and her test came back positive, right? So when do I start measuring the 2-day period or what employees were exposed, right? Well, we don't just count 2 days backwards from Monday, which is the last day I was at work. We've got to look, and for the purpose of this example, we'll say that I didn't have any symptoms, right? I had no symptoms, but my test came back positive, and I told you about it on Tuesday. I was last in work on Monday and Friday. So if we know that's the case, for example, the CDC would recommend that we look at the 2 days before the date of the test. They say specimen collection, which should be the date that your test was performed, and through the last day that I worked. So we would be looking for employees who were exposed the 2 days before the date of my test, which in this example was Friday, and through the date that I was last at work, which in this case would be Monday. And then we're going to look for those individuals who were within 6 feet for more than 15 minutes. So there's one example. Another example would be, let's say, same situation, but I have symptoms. And I tell you that my symptoms started on Monday. I call you up and say, hey, my symptoms started on Friday, excuse me. I didn't tell you about it. I came to work on Monday, but I'm calling you on Tuesday because now I feel, I've gotten a test back and it says that I'm positive, right? So we're going to look for the 2 days before the symptom onset. So my symptoms started on Friday, so the 2 days before Friday, through all the days that I worked through Monday, which was my last day. So that's the time window that we're looking for employees based on the CDC guidance who may have had close contact. And then as we're looking at that time frame, we're going to look at who had contact for more than 6 feet, of closer than 6 feet to more than 15 minutes, understanding that there may be some variables there. So I thought it would be helpful to walk through some of those examples. What should employers do if an employee comes to work with COVID-19 symptoms? Again, it's going to depend maybe in terms of cleaning how long it's been. So if it's been less than 7 days, so in the example I just gave, where I told you about it on Tuesday and I was last in work on Monday, right? Then you're going to follow that CDC guidance for cleaning and disinfecting all the areas. If it's been more than 7 days since I used the facility, then the CDC says you may not need to do any additional cleaning, but you're going to need to continue your routine cleaning and disinfecting. So in that example, let's say I was out of work for a vacation for 7 days. I then contact you and say that I have symptoms, but I haven't been to work, for over 7 days. Then the cleaning guidelines are going to be a little bit different. Okay. Other employees may have been exposed to the virus if they were in, again, close contact for a prolonged period. So we're going to look at that exposure guidance. You may be wondering, as a practical matter, how do I figure out which people during that time frame were close with this employee, especially if I can't disclose their name? One of the ways that the EEOC recommends to handle that is to ask the person. So, the HR manager could ask me, the confirmed 19 employee, Sarah, and say, well, who did you see that day, right? So that I can know who I need to think about. Might also look at scheduling or, what other matters, you might, or company documents you might have available to you. But for example, I might say, well, I came to work and I was working with Jill, and then I had lunch with Mike that day. So you can get some of that information from the employees. If an employee is confirmed to have COVID-19, again, those employers should inform those employees, we've talked about, based on the ADA guidance. Those folks who have symptoms should self-isolate, and in most workplaces, those potentially exposed but with no symptoms should, again, self-isolate for 14 days. There is an exception for some critical infrastructure businesses. That's a little bit more narrow. And employees not considered exposed should self-monitor again for symptoms during this time period. So we've kind of walked through kind of the basics here of what to do once you've had someone who's either suspected or confirmed to have COVID-19 in your workplace. What is the symptom? How to identify when someone has been exposed, meaning what time period to use to measure that, and also looking at what factors to look at to determine whether or not they've been exposed. So let's take a look at our situation. You've sent Sarah home, right? She's confirmed to have COVID-19. What do you do when you're trying to figure out when to bring her back to work? Because remember, the CDC says, follow our disposition to discontinue home isolation guidance. That's how we're going to tell you about returning to work. So we're going to walk through some examples of that here. So, essentially what the question we're answering is, when should an employee with suspected or confirmed COVID-19 return to work? And the CDC's answer is when they meet the criteria for discontinuing home isolation. So again, they don't recommend that, employees come back to work sooner than that isolation guidance provides. Again, some states have provided their own return to work guidance, and that could be from the state governor or it could be from the local health department. But today we're discussing the overarching CDC guidance as a general place to take a look at, and also for states that haven't implemented their own guidance. I mention that because some of the state guidance may be more restrictive, meaning the time periods are longer, or the requirements they recommend are a little bit different than what the CDC is recommending. So we're going to take a look at the next slide. This is the guidance on ending home isolation. This guidance was just updated on July 20th. So it's, brand spanking new. And it's going to cover a few different items. So what I wanted to sort of highlight is what the difference is between this guidance and the old guidance. So here are kind of the listed differences. The most notable difference is that a test-based strategy is no longer recommended to determine when someone should return to work, except in certain circumstances. This is a departure from the older CDC guidance, which essentially had two different strategies, depending on whether you had symptoms or did not have symptoms, to return an employee to work. And those two strategies were based on either time, on the one hand, and on the other hand, instead of time, was a test-based strategy. The CDC's new guidance is basically emphasizing either a symptom-based or time-based strategy. They also made some changes to the symptom-based strategy, meaning previously they had required at least 72 hours since the last fever without fever-reducing medications to have passed. They've shortened that period to 24 hours. They also changed in the prior guidance, you were waiting for an improvement in respiratory symptoms, but as we saw, that list of symptoms is a lot longer than just respiratory symptoms. So they've changed it to say improvement in symptoms in general, okay? And then for patients with severe illness, they have said that sometimes they may need to isolate for longer, up to 20 days, as opposed to the recommended 10 days that we're going to talk about here. And then they provide a time-based, because again, if the individual does not have symptoms, it's going to be hard for you to measure when their symptoms have been resolved. And so as a result of that, persons who never develop symptoms, they recommend that a period essentially of 10 days after the date of their first positive test. Again, that's not the antibody test, but the test to actually detect COVID-19. So here are the specific recommendations from the CDC. So I thought we'd walk through this again with our example of Sarah having COVID-19. So persons with COVID-19 who have symptoms, so again, maybe a symptom from that long list, a new loss of taste or smell, cough, or a fever, can return to work or essentially discontinue their home isolation when at least 10 days have passed since my symptoms started. So again, in that example we did earlier, right, my symptoms started on Friday. So at least 10 days have passed since my symptoms started, and at least 24 hours have passed since my fever has resolved without using, a fever-reducing medication like an ibuprofen or Tylenol, something like that. And my other symptoms have also improved. So if 10 days have passed, but, my fever's not gone down without, using medication, I might not meet all the criteria to discontinue home isolation, because you'll see it's an and. So you got to meet all three of these bullet points if you have symptoms. They do note in this new guidance that some people may need an extended isolation period of up to 20 days after symptom onset. And that's because those individuals, may have, essentially more severe symptoms. But in general, this is the guidance. It's 10 days, 24 hours, and improvement of symptoms. So then you may ask, well, what about folks who never develop symptoms? Because obviously you can't measure when their symptoms have resolved if they haven't had any. So for those individuals, you're going to look at discontinuing home isolation 10 days after the date of their first test. So again, in my example that we talked about earlier, where I tested positive for COVID-19 on Friday, I could discontinue home isolation under this CDC guidance 10 days after Friday. And so that's, important to point out, just because that's kind of the new measurement that they're looking at. Again, some states may have more restrictive requirements. Some states may say, even if you've not had symptoms, you need to stay out of work for 14 days or some other period of time. So just be mindful to check in more than one place. Okay. So, again, the CDC has provided some guidance on the role of testing, and so is the EEOC, sort of many-layered topic. But, in essence, kind of one of the main points from this new guidance is that they're recommending these symptom and time-based strategies that we just talked about, as opposed to using a test-based strategy. There are some exceptions for this, and the main point here is if you do use a test-based strategy, for example, if the person's immunocompromised or for some other reason, The CDC recommends that the person has at least 2 consecutive specimens collected, meaning 2 tests, at least 24 hours apart. And that's consistent with the guidance that they had before. They have been recommending this sort of 2-test approach, meaning 2 tests at least 24 hours apart, in order for that testing to be considered effective. So, and that's consistent. There are some states that also have similar guidance, probably based initially on the CDC's earlier guidance connected to this as well. So what about exposed employees? Because now we've talked about employees that have COVID-19 or COVID-19 symptoms, and we've talked about employees that have COVID-19 but don't have any symptoms. But what about the folks who have been exposed? Again, those folks, the CDC recommends that they self-quarantine for 14 days after exposure. This, of course, may result in some folks who've been exposed being out of work longer than those individuals who, in fact, have COVID-19. The CDC recognizes that, but what they're essentially saying is that the reason for this position is that it may take 14 days for those symptoms to show. Of course, if during that period someone who is exposed then either becomes symptomatic, right, or tests positive for COVID-19, you'd be back to that guidance that we just talked about. So someone could start out as quarantining as exposed. If they become symptomatic during that time period and test positive, or for example, they are asymptomatic but get tested and test positive, then you'd be using that guidance that we just talked about for discontinuing home isolation. We're going to take a look at the next slide. And so I'm going to turn this back over to Jill so that she can talk about the sort of myriad of issues connected to this, which is leaves of absences connected to COVID-19, because obviously when you have folks out of work quarantining because they've been exposed, or out of work because they are waiting for their period of time to discontinue for home isolation, or for a variety of reasons, you're going to have a lot of leave of absence issues all wound up in this. What makes COVID-19 a little bit more challenging for employers, I think, is there's this many layer of issues between leave issues, ADA and EOC issues, which we touched on today, but there certainly is a lot more there as well. And of course, all of this public health guidance in terms of returning employees safely to work and what to do when you have employees exposure at work. So there's sort of a many layered issue with a lot of things going on at once. And, for employers to digest at the same time. So I'm going to turn it over to Jill, who's going to take over on the leave of absence part.
All right, thank you, Sarah. That was really helpful. And thank you for the updated information from the CDC, hot off the press. As Sarah mentioned, if you've got people who are self-isolating or had tested positive or have suspected cases of COVID-19 and they're at home, of course, we're going to be dealing with leaves of absence from work. And there you'll not only be looking at your own policies and procedures, your own practices that you use for providing leaves of absence under different circumstances, but also a number of federal laws and potentially state laws that require leaves of absence in certain situations related to COVID-19 and sometimes require that those leaves of absence be paid. So I wanted to start with talking about how some of what we think of the traditional leaves of absence apply to situations involving COVID-19. The first of the federal laws I want to address is the Family and Medical Leave Act, or the FMLA, and that applies to those of you on the call who employ 50 or more employees. And basically, and the FMLA is a very technical, complicated statute, as those of you who administer it know. But the basic requirements is that employees are eligible to take FMLA leave if they work for a covered employer and they've worked for that company for at least 12 months, and they have worked at least 1,250 hours during the previous 12 months before the leave, and they work at a business location where there are at least 50 employees employed within 75-mile radius. Those are eligible employees for FMLA leave. employees who are eligible and who have a qualifying event that entitles them to leave are entitled to up to 12 weeks of unpaid leave, job-protected leave, and a designated 12-month leave year. And there are a number of qualifying conditions under the FMLA, including the birth of a child or the adoption of a child, for example. But the two that are most likely to apply in a situation involving COVID-19 are when an employee is out of work for their own serious health condition, or when they're out of work because they're needed to care for a designated family member who has a serious health condition. And of course, that serious health condition might be COVID-19. Especially if it's one for which the employee has sought medical treatment and received medical treatment on an ongoing basis, and especially if any complications develop or if they've got a more serious case or severe case of COVID-19. It's important to remember that under the FMLA, not only are they entitled to up to 12 weeks of unpaid job-protected leave, but employers are required to continue their group health insurance coverage under the same conditions as if they'd worked continuously throughout the entire time that they were out on leave. And you'll see if you ever take a look at your group health insurance plan, you'll see that your plan will actually contain language that provides specific information that allows for this. Most plans require that participants in the group health insurance plan work a certain number of hours or actively be at work in order to remain a participant, but there are provisions in the plan for covered employers indicating that certain leaves of absence, including leave that's required under the FMLA, should not disqualify somebody from being a participant. So that's the FMLA. And as we're talking about some of these new laws that apply to situations involving COVID-19, it's important to remember that the FMLA still applies to those of us that are covered, to the employers that are covered. Another traditional law that can require a leave of absence is the Americans with Disabilities Act, or the ADA. This applies to companies with 15 or more employees, and it generally prohibits discrimination against qualified individuals with a disability. A disability under the ADA is a physical or mental impairment that substantially limits a major life activity or a major bodily function. In not all cases of COVID-19, especially the asymptomatic ones, but more serious cases of COVID-19 or complications of an underlying medical condition can be considered a disability under the ADA. The ADA requires employers to provide reasonable accommodations when they're needed for a person to be able to do their essential job functions. And those reasonable accommodations might include a leave of absence or an extension of a leave of absence under the FMLA, for example, for a defined period of time that might enable somebody to return to work. Other reasonable accommodations that we might need to consider under the ADA would include measures to reduce exposure for employees that have disabilities that put them at a greater risk for COVID-19. And some of these measures, you can be creative based on your own workplace, but some of these measures are along the lines of the social distancing requirements and, the wearing of cloth face coverings, perhaps putting somebody in a different work environment or allowing them to telework, depending on what the business needs are. Of course, as Sarah mentioned, the ADA restricts an employer's ability to make medical inquiries, and it requires confidentiality of medical information. The EEOC has issued some special guidance that cover employers during a pandemic, including COVID-19, and gives employers a little bit more leeway. For example, employers now may ask employees if they've been experiencing the recognized symptoms of COVID-19, whereas typically asking employees about their health conditions or medical symptoms is restricted. The CDC states that employees who become ill with symptoms of COVID-19 should leave the workplace, and the EEOC has specifically acknowledged that the federal law, the ADA, does not interfere with employers following CDC advice. So that's good news, right? At least our federal agencies are on the same page and allowing us to follow the advice given by the other federal agency. And of course, employers must maintain all information about employee illness as a confidential medical record and to comply with the ADA. And then finally, when we talk about traditional leaves of absence, please don't forget about state laws that might apply. A number of states now require certain types of family and medical leave and paid sick leave, and those states are increasing in number all the time. I think Colorado just implemented a new paid sick leave law. So please don't forget about the state laws that apply in the states where you do business when you're looking at what leave your employees might be entitled to if they're out due to COVID-19 related reasons. So we're going to travel back in time a little bit. Y'all, any of you who were on some of our previous webinars that our firm has worked with Mike on for Nationwide Marketing Group will remember that the Families First Coronavirus Response Act, or the FFCRA, was implemented back in March. The FFCRA does provide for paid leave during this year. The law sunsets on December 31st, 2020, for employees that miss work for various qualifying reasons related to COVID-19. Since this law was first enacted, we've had a couple of things happen. First of all, when the law was enacted, it was, I believe, March 18th, and that was right when a lot of our states started implementing shelter in place or stay-at-home orders. A number of businesses started shutting down or reducing their operations considerably. We had fewer people at work generally. Now that businesses are reopening and becoming staffed on a greater basis, an increased basis, we're now seeing more and more requirements that employees take this sort of leave, especially as COVID-19 cases increase. And as we're looking at the upcoming school year, we might see even more of an increase in requests for leave under the FFCRA. Again, this is a temporary law that applies to leave taken between April 1st, 2020 and December 31st, 2020. And it provides for two different kinds of paid leave. And we'll talk about both of them. One is the Emergency Expanded Family and Medical Leave, and that is basically an expansion of the FMLA, which we discussed just a few minutes ago. And then the other is Emergency Paid Sick Leave, and that's its own unique animal. Then we'll talk about that in detail too. That is not considered a part of the FMLA or an expansion of the FMLA. It's its own thing, but as you'll see, there's some interaction between the paid sick leave and the FMLA, either traditional FMLA or this expanded FMLA. The leave that's required under the FFCRA is not retroactive. That means if before April 1st, you voluntarily, as an employer, provided employees with leave for various reasons related to COVID-19, that would now be considered qualifying reasons, that you don't get to count that leave toward the amount of leave that must be provided under the law. And any leave, any paid sick leave that an employee might be entitled to this year cannot be carried over into 2021. Some of you all might have paid sick leave policies that allow employees to carry, PTO or sick leave over from one year to the other if it's not used. But this is use it or lose it. If an employee doesn't need to use it before the law expires or sunsets on December 31st, then that leave entitlement is basically extinguished. This is the really good news. Both types of leave are 100% reimbursed by federal government, and that's done through payroll tax credits. As a result, in addition to having some guidance online from the Department of Labor, which administers the leave portion of the FFCRA, the IRS also has some guidance in line about how you can administer the leave in a way that you make sure you get the 100% reimbursement of the paid leave through your tax credits. And those are immediate tax credits. You don't generally have to wait to be reimbursed. You can just unless your paid sick leave or paid expanded family and medical leave obligations exceeded your payroll tax obligations. And we'll talk about how that works. The FFCRA covers businesses with fewer than 500 employees, which I would imagine would be most of the members on this call. There is a certain small business exception that will cover for companies with fewer than 50 employees in certain circumstances, but that's very limited. And it's only an exception to the requirement to provide the expanded family and medical leave. under certain circumstances relating to the closure of schools or child care facilities. All right, well, what does the FFCRA require? The first thing it requires is for everybody to put up a new mandatory poster in the area of your break room or other area of your facility where you've got all your other posters. So we've got a new federal poster. It's available on the Department of Labor website. And given the fact that during the pandemic, some or all of our workforce at various times might be teleworking more than usual, the Department of Labor has said that you can comply with this posting requirement by either posting the notice in a conspicuous place in the premises, or if your workforce is teleworking, by emailing or direct mailing the notice or posting it on any kind of an internal or external website that you have where you provide employee information. If you've got people who are doing a combination of teleworking and working in the facility, you can certainly do both. Make sure that people know about their rights under the law. Let's start by talking about the qualifying events for paid sick leave, or PSL, and then we'll get into how much leave they're entitled to. The law lists 6 reasons why people might be entitled to paid sick leave, but in reality, there are only 5. The first of these is that an employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. Now, an important caveat here, the Department of Labor has issued guidance saying that these federal, state, or local quarantine or isolation orders do include some of these shelter-in-place orders or stay-at-home orders. But in order to be entitled to leave, the employee, it's not enough for the employee just to be subject to or live in a state or a locality where one of these orders is in place. They have to be unable to work specifically because of that order. And what that means is that, first of all, the work has to be available to them to perform. If a business is shut down because of one of these orders, or if the hours are significantly reduced, or the employee's the employee's not working temporarily because their job has been done away with due to one of these orders, they're not entitled to leave. It's only when they are unable to work specifically because of the federal, state, or local quarantine or isolation order. And that's a lot more limited than how some of us read this initially before the Department of Labor came out with a guidance. An example might be that if you live near a state line, let's say I'm in North Carolina, so I'll use Charlotte, North Carolina as an example. Charlotte is very close to the southern border of North Carolina, and you don't have to drive far to get into South Carolina. If you live in South Carolina, for example, and you commute to Charlotte, North Carolina for work, and there's a shelter-in-place or stay-at-home order in South Carolina that would prevent you from traveling to North Carolina to your office, that's the type of situation where you are unable to report to work because of that shelter-in-place or stay-at-home order. Now, it's possible you might be able to telework, and if so, you're not entitled to leave. So it's a lot narrower than we initially thought. The second qualifying event is if an employee is advised by a healthcare provider to self-quarantine or self-isolate due to COVID-19 concerns, if an employee is experiencing COVID-19 symptoms and seeking a medical diagnosis. Those are both qualifying events. And you'll see that this list does not include a specific qualifying event that says, what if an employee tests positive? Are they entitled to this leave? What the Department of Labor says is that these 2 criteria here, they're advised by a healthcare provider to self-quarantine, or they're experiencing COVID-19 symptoms and seeking medical diagnosis, combine. Most people that test positive for COVID-19 are advised to self-isolate by a healthcare provider. And if somebody's experiencing COVID-19 symptoms and they seek a medical diagnosis, and the diagnosis or the test comes back positive, and they still got some paid sick leave left or paid time off left, they would be entitled to, continue on leave with their COVID-19 diagnosis. The fourth criteria is if an employee is caring for an individual who is subject to a federal, state, or local quarantine or isolation order, or advised by a healthcare provider to self-quarantine due to COVID-19, or if they're caring for a child, if the child's school or place of care is closed, or if the child's regular care provider is unavailable due to a public health emergency. And then the law throws in a catch-all provision saying, any other qualifying event that the Department of Labor might say qualifies someone for leave. At this point, there are not any other qualifying events. So we're really looking at these 5. Employees unable to work or telework because they're subject to a federal, state, or local quarantine or isolation order. They're advised by a healthcare provider to self-isolate. They're experiencing symptoms and seeking a medical diagnosis. They're caring for an individual who's either subject to an order or advised by a healthcare provider to self-quarantine, or they're caring for a child due to childcare or school closure. Paid sick leave, here are the nuts and the bolts. All employees on your payroll are eligible. There's no waiting period. There's 80 hours of paid sick leave allowed or provided for each employee. And that's essentially intended to be 2 weeks if it's a full-time employee. If it's a part-time employee, there are other ways provided by the Department of Labor guidance to determine how many hours 2 weeks of part-time work would amount to based on the average number of hours that the part-time employee works. The pay for an employee's own symptoms or illness, they get their regular pay capped at $511 per day, or an aggregate total of $5,110 for the 80-hour 2-week period. If it's for the need to care for others, whether it's due to a child care or school closure or other COVID-19 related reasons that qualify, the employee receives 2/3 their regular rate of pay with different caps. For emergency paid sick leave, employers may not reduce an employee's paid time off accrual or require the employee to first use existing leave benefits before taking advantage of the paid sick leave. The family medical leave expansion is a little different. If an employee is unable to work or telework because the employee's son or daughter under age 18 is home due to a school or child care center closure or due to the unavailability of a child care provider because of the COVID-19 emergency, that's when an employee is entitled to EFML. And if you think that looks familiar, there's a good reason why. That is one of the factors, the 5 factors that would entitle somebody also to the 80 hours or 2 weeks of paid sick leave. So that's an overlapping factor. This does have an eligibility requirement. An employee has to be on payroll for 30 calendar week days before they're eligible for the expanded FML leave. And they're entitled to up to 12 weeks of job protected leave. There's a waiting period here, and it is the 10 work days or 2 weeks of unpaid leave that overlaps with the paid sick leave requirement or paid sick leave allotment. And then after that 2-week waiting period, there's an additional 10 weeks of paid leave provided. That additional 10 weeks can be coordinated with paid sick days. And since this is an overlapping requirement with the paid sick leave, if, for example, you've got somebody who's not able to work due to a child care center closure and they need to care for their son or daughter under age 18, that person would be entitled potentially, if they haven't already used their 80 hours of paid sick leave for another qualifying reason, to 80 hours of paid sick leave at the rate of 2/3 of pay, and then an additional 10 weeks of FML leave at the rate of 2/3 rate of pay. If somebody has PTO or sick leave that otherwise would apply here, we can't require employees to substitute other paid leave, but we can allow that substitution if the employee elects to. An example of how that might work is, the expanded FMLA leave requires no less than 2/3 pay for the normally scheduled hours during the 10-week paid period. And if somebody wants to use their existing PTO or accrued leave to bump that 2/3 pay up to full pay, they're entitled to do that if the employer agrees. As I mentioned, the Families First Act was enacted back in March, and the Department of Labor has since provided a lot of really excellent guidance to us. This is a very technical law. My intention here today is to alert you to the big picture issues so that you know what to look for. But I encourage you that if you have somebody who needs this kind of leave, please reach out to your friends at Nationwide Marketing Group with questions, consult the Department of Labor website, make sure that you understand how these laws work and how they interact with each other, because they are very technical, and the way that laws interact will vary considerably depending on the individual circumstances. But I wanted to run through some of the guidance that the Department of Labor has provided, both in regulations and also in frequently asked questions that are available on the website and that are updated constantly, practically on a weekly basis. One of these areas of guidance is on calculating paid leave. Generally, the regular rate of pay for purposes of determining how much pay someone's entitled to under the FFCRA is an average rate of pay for 6 months before the leave begins. And for those of you who have salespeople or other employees who are paid based on a commission basis or tips or piece rates, those commissions, tips, and piece rates should be included in the regular rate of pay. For part-time employees, use the average number of work hours in a 2-week period. That's the number of hours an employee is regularly scheduled to work. If the normal work hours are unknown or if the schedule varies, then you can use a 6-month average. The family and medical leave expansion, that leave must include overtime hours normally worked in the calculation of the regular rate of pay. But the paid sick leave is capped at 80 hours, so you don't need to include the overtime hours normally worked. And there's also no need to include the overtime premium, the time and a half, the additional half-time premium in either the paid sick leave or the family medical leave. The Department of Labor has provided some good information on the stacking of leave, and we've talked about this a little bit already. There's a total of 2 weeks or 80 hours of paid sick leave available for any combination of qualifying reasons. If an employee is home with a child because of a school closure or child care center closure, then that employee might be entitled to 2 weeks of paid sick leave and then an additional 10 weeks of expanded family medical leave for a total of 12 weeks. They don't get to tack the additional 2 weeks of paid sick leave on at the end of the 12 weeks of family and medical leave. Also, an employee is only entitled to take 12 weeks of family and medical leave total, and that includes both the traditional and expanded Family and Medical Leave Act leave. So what that means is if you've got someone who during the same leave year has already used, let's say, 4 weeks of leave for a qualifying reason under the traditional FMLA, such as the birth of a child, then they would only be entitled to an additional 8 weeks of expanded Family and Medical Leave Act leave under the FFCRA. And also an employee is always eligible for paid sick leave no matter how much FMLA leave they might have previously taken. So they could have previously used all 12 weeks of FMLA leave, whether it's traditional or expanded FMLA leave, and they still would be entitled to paid sick leave if they have a qualifying event come up. There are some detailed provisions in the Department of Labor guidance on the substitution of accrued leave during the first 2 work weeks of the Unpaid Family and Medical Leave Act expansion. An employee may not simultaneously take paid sick leave and pre-existing paid leave unless the employer agrees to allow the employee to supplement the amount of paid sick leave with accrued paid leave up to the normal salary. In other words, to bump the employee up from the 2/3 pay to the full pay during that first 2 work week waiting period. But an employee can opt to use either paid sick leave or accrued paid leave during that expanded FMLA leave period. After the first 2 weeks end, the employee may elect or the employee may be required by the employer to take the additional expanded FMLA at the same time as any existing paid leave that would be available under that circumstance. Now, note that the Family and Medical Leave Act is limited to situations where somebody can't work because they're needed to care for a child due to a school closure or a child care closure. if they're normally not entitled to take sick leave, then, they're not sick themselves, then that sick leave wouldn't be available to them. So if you're talking about substituting accrued leave under your policies, be sure that it's the type of leave that the employee would be entitled to use under normal circumstance for the reason that they're out. If the employee is required to take existing leave concurrently with remaining family and medical leave expansion, the employee must be paid the full amount they're entitled to receive under the existing paid leave policy for the period of leave taken. And then if the pre-existing paid leave is exhausted, any remaining family and medical leave may be taken at a 2/3 pay rate. In other words, you're not allowed to say, okay, you only get 2/3 pay under the expansion of the family and medical leave, so we're going to require you to use your accrued PTO, which normally would be paid at the full rate of pay, but we're only going to pay you at the 2/3 rate. The employee, if they have to take the leave concurrently during the family medical leave expansion, then they should receive the full amount that they ordinarily would be entitled to receive under your policies. An employer may not require an employee to use accrued vacation, personal, medical, or sick leave before or concurrently with paid sick leave. The paid sick leave should always be available and should not diminish the accrued leave. This is true of paid leave that would otherwise be available to the employee either under your regular policies, under federal, state, or local law, or under a collective bargaining agreement if you're a unionized workplace. If the employer and the employee agree, the employee may use pre-existing leave entitlement to supplement the amount received from paid sick leave up to the employee's normal earnings. And those are for the qualifying reasons for paid sick leave where you're caring for others, where you only would be entitled to 2/3 pay. Remember, if you decide to offer paid leave, whether it's under your policy or because you're trying to help your employees, we certainly encourage you to do that. But remember that you're not entitled to receive a tax credit against your payroll taxes for any paid sick leave that's not required to be paid or that exceeds the limits that are set forth under the federal law. A few quick notes on intermittent leave. I want to be sure we have time for questions. If an employee is unable to telework during normally scheduled work hours due to one or more of the qualifying reasons for either paid sick leave or family and medical leave, the employee and the employer may agree that the employee may take paid sick leave intermittently while teleworking, and that can be in any increment on which the employee and employer agree. Intermittent leave is more restrictive if an employee is working at the job site, though. An employer and an employee may agree to allow intermittent family and medical leave or paid sick leave for the reason of caring for an employee's child whose school or place of care is closed because of COVID-19 related reasons. And they give an example in the Department of Labor guidance that an employee could take paid sick leave on Monday, Wednesdays, and Fridays, for example, to care for their child and work at the normal work site on Tuesdays and Thursdays. But for the other qualifying reasons, intermittent leave is not available if the employee is required to work at the job site. And that's primarily due to the concerns about contagion. If you've got somebody who's caring for someone else who's been diagnosed with COVID-19, for example, you don't necessarily want them coming in and out of your workplace because they've been exposed. They might potentially either have asymptomatic or later develop symptomatic COVID-19. We've provided a lot of details in our slides, which will be available to a nationwide marketing group. I'm going to run through some of these fairly quickly to make sure we have time for questions. The Department of Labor does have some guidance on what happens if your work site is closed or if you furloughed employees or reduced hours in terms of the paid leave. The general guidance here is that if an employer closes the work site and no work is available for the employee to do, even if that's because you're under an order from your state or local government that requires you to close the work site, that employee will not be entitled to receive paid sick leave or expanded family and medical leave under the FFCRA. The work has to be available for an employee in order for them to be unable to work or telework and entitled to receive the leave benefits. If they're not entitled to the leave benefits and the work site is closed for lack of business or due to an order, or if an employee is furloughed because of lack of work, that employee might still be entitled to receive unemployment benefits. Just like the Family and Medical Leave Act, an employer must continue group health insurance during the expanded family and medical leave. And we can still, of course, require the employee to continue making any normal contributions to the cost of coverage. While an employee is on paid sick leave for their own illness, we also have to continue group health insurance coverage based on any plan language that might exist where the absence is treated as being actively at work. So check your plan language or check with your insurance provider if you've got somebody who's out on paid sick leave for their own illness as to how you should handle their health insurance coverage while they're out. Otherwise, COBRA applies to employers with 20 or more employees upon a separation or upon any reduction in work hours that might cause the employee to lose group health plan coverage. So check with your health insurance carrier or provider on that. Employees who take paid leave under the FFCRA are entitled to be returned to the same or a nearly equivalent job when they return to work. Employers are prohibited from firing or disciplining or otherwise discriminating against an employee for taking this protected leave or for filing a complaint or a proceeding relating to what they think are FFCRA violations or testifying in that kind of a proceeding. Employees are not necessarily protected, though, from employment actions such as layoffs or reductions in force that would have affected them regardless of whether they took the leave. So if you have to reduce your workforce because of a slowdown in business or for other reasons, and the person who is on FFCRA leave, whether it's expanded FMLA or paid sick leave, would otherwise have their job eliminated or lose their employment based on your reduction in workforce, then the employee is not necessarily protected. The employer, though, does have the burden of showing that they had legitimate reasons for the reduction or for the layoff and for eliminating that person's job, and would have to be able to demonstrate that that employee would have been laid off even if he or she had not taken protected leave. And that's where your documentation is going to be key. If you do have to let somebody go because of a workforce reduction and they're on protected leave, be sure you document very clearly not only your reasons for the reduction, but also why that particular employee was caught up in the leave. There are a couple of exceptions to the reinstatement requirement. These are very narrow. They're kind of unwieldy. They're difficult to demonstrate. One is that an employer may refuse to reinstate an employee in the same position if they're a highly compensated key employee as defined under the FMLA. This is a very difficult burden to meet. A key employee has to be among the highest paid 10% of all your workers, both salary and non-salaried, who are employed within 75 miles of the workforce. And the employer also has to qualify with certain notice provisions for key employees in order to be able to be exempted from the reinstatement requirement. There's also a special FFCRA exemption that we provided here. Basically, there's no reinstatement obligation if we have fewer than 25 employees and the employee took the leave to care for a son or daughter whose school or place of care was closed, and all four of certain hardship conditions exist. And one of those is that the employee's position no longer exists due to economic or operating conditions that affect employment due to COVID-19 related reasons. Then there are some other provisions that you see here that require us to make reasonable efforts to restore the employee to the same or equivalent position and to continue to contact the employee for a certain period of time after the leave concludes if such a position becomes available. There may be some reasons why you might be able to take advantage of this. Generally, though, if you're going to have a reduction or a job elimination for business-related reasons, it's in most cases, you're going to be able to just demonstrate that the person would have been let go regardless of whether they were on job protected leave and simply deny reinstatement on that basis. The Department of Labor provides certain guidance on exposure concerns upon returning to work. And this looks back to the topics that Sarah discussed. If you've got somebody who took paid sick leave and there are ongoing concerns about COVID-19 exposure because perhaps they had symptoms or they are exposed to someone with COVID-19 that they're caring for, you can look at returning them to work at the end of the leave through teleworking or temporary reinstatement to an equivalent job requiring less interaction with other people. You can still require compliance with job-related requirements that would apply regardless of whether the person took paid sick leave. For example, if the employee knows that the employee has interacted with a COVID-19 infected person, the employer still can require them to telework or take leave until he's cleared to discontinue home isolation and return to work under CDC guidance, even if the time period during which they're allowed to take paid sick leave has already expired. The Department of Labor provides some information about what documentation you're entitled to collect as an employer if someone requests paid sick leave or family and medical leave. I encourage you to make sure that you keep all of this documentation. It's not quite as extensive as the type of documentation we might receive if we were allowing somebody to take, for example, traditional FMLA, but that harkens back to what Sarah said about how all of the government agencies are alert to the fact that healthcare providers may be especially busy right now and not be able to provide the type of documentation that an employee might need for leave-related reasons. Be sure you keep that documentation, though, because in order to get your tax credits with the IRS, you will need that documentation. There's a process that's available on the IRS website, along with some frequently asked questions and guidance about how to claim the tax credits. And again, these are intended to be immediate tax credits. The employer would be entitled to reduce the federal employment tax deposits by the amount of the required paid leave. And if your tax credits exceed the amount of your payroll tax liability, then you can submit a form for reimbursement of the rest. There is, as I mentioned, a small business exemption to the FFCRA, and this is pretty limited. If we have fewer than employees, we're exempt from providing paid sick leave or family medical leave for the reason of an employee being needed to care for a child when a school or place of care closes. And when doing so would jeopardize the viability of the small business as an ongoing concern. This is a little bit of an honor system basis here. A small business can claim the exemption if an authorized officer of the business has determined that the provision of paid sick leave or family medical leave would result in the small business's expenses and financial obligations exceeding available revenues, cause a small business to cease operating at a minimal capacity. And then there are some other requirements that you see here relating to whether the absence of the employee causes a hardship to the business and whether there are sufficient workers to fill in for the employee. This is really narrow, and it can be applied either to the paid sick leave or to the family medical leave requirements or to both. But I encourage you, if you want to claim this exemption, to talk with your accountants who know your individual business circumstances about whether this is an exemption that's available to you, and be sure you document it appropriately in case you are audited either by the IRS or the Department of Labor at some point. And then finally, before we open it up for questions, the CDC has published some guidance for minimizing disruption and protecting employees that's specifically designed for small businesses. You can find this on the CDC's website. The CDC essentially has recommended that we identify a workplace coordinator who's responsible for keeping up with COVID-19 issues and their impact on the workplace and making sure that the employer is compliant with the most up-to-date requirements and guidance. Examine policies for leave, telework, and employee compensation. And all of the government agencies are really encouraging businesses to be flexible with employees to the extent possible now as we get through this pandemic together. Leave policies should be flexible and non-punitive and allow sick employees to stay home and away from coworkers. Leave policies should also account for employees who need to stay home with their children if there are school or child care closures or to care for sick family members. When possible, use flexible work sites such as telework and flexible work hours such as staggered shifts to help establish policies and practices for social distancing. Review your leave policies with all employees and provide them with information about assistive services and how they can take steps to protect themselves, both while they're at work and away from work. Identify your essential employees and business functions and other critical business concerns, such as your supply chain, for example, and determine how you're going to maintain business operations if there are disruptions, either to your essential employees or to your supply chains or other business functions. Prepare business continuity plans for significant absenteeism, and this is especially significant as we're looking toward the reopening of school this fall. For supply chain disruptions or for changes in the way you need to conduct business. Create an emergency communication plan with the identity of key contacts and chains of communication, and share your response plans with employees and clearly communicate what's expected of them in terms of not only complying with these guidance and requirements while they're at work, but notifying you if they do have symptoms or if they are exposed at work or outside of work to individuals who are known to have COVID-19. We have covered a ton of information. And Mike, is there any time for questions?
So Jill, we do have a few questions that have been submitted. If you're up for answering those, we'll go ahead and take those top questions and get those answered. If you and Sarah are ready, we'll start with the questions now.
Absolutely.
Okay, so we'll start off with a current events question. I read a news article this morning about a restaurant who had an employee make a false claim of having COVID-19. They had to close. It cost the employer about $13,000 in lost business. What, if any, recourse does a business owner have if an employee falsely claims to have COVID-19?
Oh boy. Sarah, have you had this arise? I've got a few initial thoughts.
Yes, there was a case like this that actually arose in Georgia. And I believe that employee, and I'll double check, is being subject to criminal prosecution. And because the sick leave was being the false COVID-19 test went through email, there's some interstate commerce issues as well. There was a fairly recent event of that here in Georgia. And while Jill's giving her thoughts, I'll pull up the details of that.
Yeah, well, certainly that would be a valid basis for terminating employment. I think that goes without saying. In terms of the business loss, though, you'd want to consider your circumstances and think through whether there's any potential civil liability on the behalf of the employee. But most employees are going to be fairly judgment-proof, and it'd be difficult to recover the amount of business that was lost, even if there was a basis for proceeding with civil liability. But based on Sarah's experience, it sounds like there's also the potential for criminal liability here, and perhaps reparations can be paid. Other than that, though, I mean, what you've got with the restaurant is both the issue with the lost business, but also the potential public relations concerns of word getting out in the community that you're one of the restaurants that had to shut down. So I haven't personally encountered that with any of my clients yet, but that's certainly a problem. Just like any type of paid leave or unpaid leave, it's always good to stay alert to abuse of it, and there will be abuse of it out there, unfortunately, and I hope that doesn't become a commonplace thing. If there are criminal actions brought against people who engage in this kind of behavior, hopefully that'll act as a bit of a deterrent.
Right. And just to give an update, our firm actually did an article on this in May. It's the Atlanta office of the Justice Department. And in that case, essentially, they filed a criminal complaint against someone who falsely told their employer that they had COVID-19. I think that case is still pending. And of course, the employer had to shut down as a result of that. And so, it turns out, one of the questions that we addressed was, well, why was that a sort of federal issue for the DOJ? And it was because the note was sent via email. And so the email went through the servers in Iowa and Kansas before arriving in the employer's headquarters, which is how that an interstate commerce issue. So that's sort of an interesting story, but that's also an article about that is available on our firm's website. If you haven't signed up for some of our firm blog notifications, articles, or newsletters, or taken a look at our Coronavirus Resource Center, we would certainly welcome folks to do that as well.
And I would certainly encourage all members, if you get a chance, to take a look at that. Some very insightful and powerful information there. So a great resource to add to your toolkit. And a solid answer there. We'll go to our next question. Does the CDC have any guidance for employers regarding employees that go on vacation, especially if they choose to visit hotspots, as they may not know who they've come in contact with and could potentially be taking risk of exposure?
Oh gosh! Go ahead.
Go ahead, Sarah.
I don't think the CDC has issued any guidance, but I believe the EEOC, specifically for employers about that, the CDC has covered, for example, what areas are hotspots. The EEOC and so the Equal Employment Opportunity Commission, I realize there's a lot of C's floating around there, did cover some guidance, I believe, related to travel, allowing employers to ask employees questions when they return from travel during a pandemic about their possible exposure to the pandemic. The specific question was, when an employee returns from travel during a pandemic, must an employer wait until the employee develops symptoms to ask questions about exposure? And the EEOC's response was no, because these would not be disability-related inquiries. If the CDC or local health departments recommend that folks who visit specific locations remain at home for a period of time, an employer may ask whether employees returning from these locations have had exposure, even if the travel was personal travel as opposed to business travel. All that being said, it's a little bit harder from when that guidance was originally issued, I think, to identify what hotspots are, since the original map was a little bit more localized and is now not quite as localized.
All right, fantastic. And go ahead, Joe.
Oh, one other quick point on that. We've received some questions from employers about whether they can implement policies that either restrict people from traveling on their own time to COVID-19 hotspots or require them to stay out of work, basically quarantine them when they return. And that gets into a really murky area. The CDC really hasn't addressed that directly. There are some state laws that prohibit employers from discriminating against or taking action against people for engaging in lawful activities outside of work. And, there's some potential if we're looking at restricting employers' travel activities outside of work, there's some potential that those off-duty laws might prohibit employers from restricting travel off-duty like that. And also, there's been some discussion about whether that employers are able to prohibit people from traveling to a COVID-19 hotspot to care for a family member or another individual if needed who's got COVID-19. And certainly we can't restrict people if they're needed to travel for those reasons.
Right, and piggybacking on what Jill has said, you can. I think, of course, if you do require some travel for business, many companies have restricted business travel in one fashion or another.
Yeah.
As
Sarah said, yes. And as Sarah mentioned, whether it's business or personal travel, an employer is entitled to ask questions about an employee's travel plans and symptoms and exposure.
All right, we'll move to our next question, and this is regarding exposure as defined by the CDC. Do you believe that to be defined as 15 consecutive minutes or 15 minutes collective, for example, 3 5-minute face-to-face conversations?
Oh, that's a great question. So,
a good question.
It's a great question. So I think, the CDC's definition specifically says, equal to or greater than 15 minutes. And they do provide, I think a lot of folks, they would say that's prolonged exposure, meaning the length of time is 15 minutes or more. Because they believe that brief, shorter interactions are less likely to result in transmission. That being said, sometimes you've got to use a little bit of judgment. For example, they've provided an example before, like perhaps you only had contact with the person for 2 minutes, but during that time, the infected person coughed directly in your face, right? The interaction wouldn't reach the 15-minute increment, but the contact would be a little bit different. So, although they, generally I'd say it's 15 minutes of close exposure, you might have to use a little bit of judgment depending on the type of scenario.
Understood. Okay, our next question, taking the word of an employee that states that he or she has tested positive or negative makes us nervous, especially since it would require that other employees that were exposed to have to self-quarantine for 14 days without pay. If we prefer to require written confirmation of test results and keep that medical paperwork separate from employment files, are we protected if we consistently require documentation as situations come up?
So I think generally the answer is yes, you can require that employees provide you confirmation that they tested positive. There may be some iterations of what documentation you can require in connection with, for example, Families First Coronavirus Response Act leave. That documentation is a little bit different, but in general, I think you can require, the employees provide you with some confirmation. Of course, that information is confidential, subject to ADA protection, and would need to be maintained as confidential medical information. Jill, do you have anything to add to?
I know the only note to add is note that the ADA, the Americans with Disabilities Act, not only requires us to keep medical information confidential, but also requires us to keep any medical documentation that we might collect in a separate place, separate from the regular personnel file. So if you do end up collecting confirmation of either negative or positive COVID-19 results, that of course would be considered medical documentation, and it should be stored somewhere else in a separate medical file and not just tucked into the employee's regular personnel file. That's the only other comment on that.
Oh, and of course, the last item is there may be some state restrictions that prohibit you from, there may be some states that have additional layers of state laws or executive orders that are layered on top of that. So if you're considering, implementing such policy, it may be good to get a little bit of additional guidance on that front.
Very good answer, very clear on that. I will say that we've had several people ask for just a general feel of how many of the members here have had someone test positive on their team. So you will notice on your screen, we've got about a minute left. We'll leave that quick poll open, and then I'll share the results with you as far as what those are. Now, our next question, I'm going to take a deep breath here. So this is going to be a little bit of a long one, Jill and Sarah. Feel free to have me go back on any of it that you'd like. Is it advisable for an employer to have employees sign a waiver of liability from contraction of COVID and recognition of the company's COVID prevention requirements, such as social distancing, masks, etc., before an employee can return to the office or travel for business when the employer has provided a work from home option for those employees?
So, Mike, to be sure I understand, the employer has provided a work from home option. Employees are permitted to telework, but the employee wants to come to the job site or travel for business. And the question is whether, do I have that right?
Yes, the question there is, with that option in place to work from home, would it be advisable for the employer to have those employees sign a waiver of liability from contraction of COVID and recognizing the company's COVID protection requirements?
In most cases, and it's a state-by-state issue, in most cases, a workers' compensation claim against the employer cannot be waived by a waiver. In other words, an employee cannot sign away their right to bring a workers' compensation claim if they were to contract an occupational disease, which is what COVID would be if they can prove that they contracted it in the workplace. But there are, I want to say, first of all, there are a number of states who have implemented laws that protect an employer from liability. Some of these laws, they all differ. Some of them relate to a workers' comp claim. Some relate to third-party liability against customers or other third parties who are not employees who might have contact with your workplace. So those laws might protect you to some degree. But in most cases, a employee who might be able to show that they've contracted COVID-19 at work due to exposure at work would be entitled to bring a workers' compensation claim, and those cannot be waived either in advance. An employee cannot waive a future workers' compensation claim, and in most states, they also cannot be waived or released without the approval of the state agency. In North Carolina, that's the North Carolina Industrial Commission. You certainly, though, could require employees, to sign off on an acknowledgement of your COVID-19 social distancing precautions and the expectations that employees are expected to follow when they return to work, and acknowledge that, they will follow those procedures and that they will let the company know if they have symptoms or if they know that they've been exposed, et cetera, et cetera, et cetera. Sarah, did you have anything different or additional?
Yeah, and piggybacking exactly on what Jill said, if you're thinking about doing some of that paperwork acknowledging what you're doing, you want to be careful in how you do that, because it may have OSHA implications if an employee makes a complaint to OSHA, and you're required to, provide your paperwork in response, and either in response to a written letter or as part of an on-site investigation. So being careful in the crafting of the language of your policies so that you're not buying yourself a safety issue down the line is important. And as a general reminder, OSHA has specific recording and reporting obligations for covered employers as well that may be impacted that require a specific analysis too in terms of reporting and recording injuries or illnesses, hospitalizations, etc., related to COVID-19. So there's that concern as well, in addition to everything Jill has covered. And of course, there are some other claims that, aside from workers' compensation claims, that can't be released legally by a waiver either. For example, Fair Labor Act claims and things like that.
Right. And thank you for the comprehensive answer on those. I will share really quickly of the poll, with 54% of those attending today's call responding, 27% said yes, they have had a diagnosed case within their team, and 73% no. So it's certainly a reality just within these dealers here. We've got about 5 more questions. We'll go through these quickly. During FMLA continued health insurance coverage, how are the employees' premium requirements covered during that period of time? Normally, they're deducted through payroll.
If I understand the question correctly, yes, you may still deduct the premiums from the amount that an employee is paid for the 10 weeks of the expanded FMLA leave that's permitted under the FFCRA. Now, that pay during that time period is at 2/3 of their regular rate of pay, unless it's supplemented with some type of accrued, PTO or other accrued paid leave that brings them to 100%. But if you're paying the employee portion of the premium through payroll deductions, you can certainly continue that through the paid portion of the leave. If that's not possible, if you're not, paying that paid leave through regular payroll, for example, then you could certainly make other arrangements for the employee to pay their portion of the premiums during the expanded FMLA period, just like you would under unpaid leave for the FMLA. And employers do that a variety of different ways. If there's a period of unpaid FMLA leave, for example, under traditional FMLA, some employers require employees just to write a check to pay for the premiums, the employee's portion of the premiums during that leave. Others will cover the employee's portion of the premiums and then require reimbursement once the employee returns to work. But I think most employers, in my experience, do, if the leave is paid, continue the payroll deductions for the employee portion, or if it's unpaid, require the employees to keep up with their premium payments in real time through an arrangement that's agreed upon with the employee at the time that they go out on leave. So there's not the concern about the employee returning to work and then having to reimburse the company, or perhaps the employee decides not to return to work, and then you've got the problem of having expended, money on the employee's portion of the premium and not being able to readily collect it.
Understood. And our next couple questions are in regard to childcare. Is there an age on childcare as defined, with the assumption that a 12 or 13-year-old might be old enough to be home alone? Is there any guidance on what would qualify as the right age bracket for childcare?
Yes, in fact, there is. According to the IRS, a child who's 14 or over is generally presumed to be able to care for themselves while they're at home. So if you've got an employee who's got a 15-year-old kid, for example, and their school is closed, and the employee is saying they need time off work because they're needed to care for their kid who's at home while the school is closed, that employee would have to show that special circumstances exist of some type that would require them to be at home with this child. And the employer should keep documentation, require documentation, and keep documentation of those special circumstances that exist. With the presumption being, as the questioner indicated, at a certain age, kids are generally presumed to be able to care for themselves without an adult at home. There's also, you should know that if you've got a person with special needs, this borrows from the traditional FMLA. There are some circumstances where if you've got a son or daughter who's over the age of 18 and has special needs and is unable to care for themselves, where an employee might be entitled to take FFCRA leave if the normal child care provider or school is closed, if the child has special needs. And there's some guidance from the Department of Labor about that.
Understood. And does the EMFL apply to, say, a father whose child is home due to school closure, even though the mother would normally care for the child, or vice versa? Would it apply to the mother if the father was normally at home caring for the child?
The Department of Labor has actually provided some really helpful guidance to employers on this, and it's employer friendly. The employer is entitled to obtain a certification from the employee requesting leave that they are actually needed to care for the child at home. And if it's a circumstance where there's another parent at home or another caregiver at home who typically would provide that leave, then the employer can certainly require certification as to why now the employee is needed at home. Bear in mind, though, that even in those situations, the Department of Labor points this out too, there might be changed circumstances or special circumstances. For example, if in the, earlier in the pandemic, let's say the spring semester of 2020 that we've already gone through, if the child's father was able to stay at home, for example, and care for the child, enabling the mother to go to work for you as her employer. For the fall semester, you might get a request from the mother to stay at home for a period of time to care for the child if the school is closed. And you shouldn't automatically assume that the father remains available. It may be that the father was, for example, out of work in the spring because the father was furloughed or the place of business was shut down, and that's no longer the case. So yes, you can certainly require the employee to certify that they are needed and that there's no other adult available to care for the child, and that specifically has been addressed by the Department of Labor, but also just be sensitive to the fact that circumstances change. And just because a parent might not be available or needed to care for the child during one period of time doesn't mean that they might not need leave now. And Sarah, I don't know, do you have anything to add or any additional guidance?
No, I just thought I would add as well. I think that employers will encounter that circumstance exactly as Jill described during the presentation more as we head towards the school year, as parents may be adjusting child care duties, and that also connects to the intermittent leave portions that you talked about, Jill. I think employers may see more requests for intermittent leave.
Understood. And this will be our last question we'll be able to take here live on the webinar. And it is an FFCRA question. Employees whose work site has been closed due to a government curfew. The understanding is they are not eligible for EPSL. Is that correct?
Yes, if the employer's work site is closed for any reason, whether it's a government curfew or a lack of business, any reason, that means that the work is not available for employees, and the employees would not be eligible for EPSL or expanded FMLA. They might potentially be eligible to receive unemployment benefits under your state's laws, as those might be expanded during the COVID pandemic based on the CARES Act expansion. Sarah, anything else on that?
Nope, that's exactly right. And I think the same sort of follow-up question applies also if the employee is on furlough. So for example, the employer is open, but the employee is furloughed. Can they receive benefits under the FFCRA? The answer is similar. The answer is no. If the employee is on furlough because they don't have enough work, if the employee is on furlough because the employer doesn't have enough work for them, the employee is not entitled to take paid sick leave or expanded family and medical leave, but again, may be entitled to unemployment insurance benefits. But once the employee is brought back from furlough, that's when they're going to kick in, again, to some of these more complex FFCRA questions.
And the same is true, building on what Sarah said, the same is true if there's a reduction in work hours due to lack of business or for any other reason. If an employee's work hours are reduced and they want to, make up for the reduction in work hours by receiving some type of paid leave, they wouldn't be entitled to it because that work's not available. But under some states, depending on the degree to which their work hours were reduced, they might be eligible to receive unemployment benefits to make up for the reduction in hours.
All right, understood. Again, to Jill and to Sarah both, thank you so much for all the time and expertise that went into preparing today's presentation. We certainly do appreciate that, and we appreciate each of you. To our members here on the call, do hope you found this very informative. We will have this available for you again after we have concluded here. But we thank you for joining us today. If you have any questions, I will tell you again, ask@nationwidegroup.org remains available for you, and we welcome your questions there. Everyone have a great afternoon, and thanks again.